Hi, my name is Ashley Cifuentes and I'm going to be doing a trauma assessment for my clinicals. I have assessed my scene. It's safe. The fire and police department have cleared me to go work on the patient because it is the scene of a motor vehicle accident involving my motorcycle. I put on my protective gloves and other protective equipment that I would need on the scene of this crash. I determined the mechanism of injury is complications of throttling a motorcycle too much. And I do need an ALS intercept, so I'm going to call for that right now. And I'm going to consider stabilization of the spine as he landed on his back. My general impression is that I walk up to the patient, I see a 6-foot male, approximately 190, looks about to be 35 to 40 years old, and he's grimacing in pain. His breathing is non-labored, and he looks to be alert. Hi sir, my name is Ashley. I'm gonna be your EMT. Can you tell me your name?
My name is Cruz.
Can you tell me where you are?
I am at an intersection on Alameda Street.
Okay. Can you tell me what day it is?
Today is May 4th.
Can you tell me what happened?
I was riding my motorcycle and a car came out of nowhere where I overcorrected and I fell off my bike.
Alrighty. He is 4 times alert. His chief complaint is his back pain and chest pain. He has no apparent life threats. I'm going to assess his airway right now. Hi sir, I'm gonna push your jaw forward so I can look at your airway. This might hurt just a little bit. All right, his airway is patent and will stay patent. His breathing is present and equal. There is no need for an adjunct as his breathing is non-labored and is non-complicated. He has adequate ventilation and he does not need oxygen therapy. He has chest pain, so I'm gonna go ahead and assess that. Sir, can you tell me where it hurts?
All right here. In this
Does it radiate to your shoulder?
No.
Okay, sir, does anything make it better or worse?
Nothing right now.
Okay, okay. Okay, it doesn't compromise his breathing or ventilation. I'm gonna check your pulse, sir. His pulse is strong and bounding. His color of his skin is pink, cool, and dry. I need to do shock management by putting him on ventilation of 15 liters per minute oxygen by a non-rebreather mask. He is a high priority patient due to the trauma sustained, and I'm going to call this into the hospital and the current ALS intercept on its way to me. All right, sir, I'm gonna start an exam where I'm gonna feel around your head and parts of your body so I can make sure nothing extreme and possibly life-threatening could be happening right now. All right, and I'm gonna ask you some questions while I do so. Okay, so has anything happened like this before?
No.
I'm checking for crepitus and any bone deformations. Does anything hurt besides your chest and your back?
My leg got scraped.
Okay. There's no raccoon eyes or any cerebrospinal fluid pooling in the nose or coming out of the ears. I check for JVD, jugular vein extension, and tracheal deviation. Feeling your shoulder. What medications do you take? Do you take any over-the-counter? Any,
Just aspirin sometimes.
what do you take that for?
Back pain mostly.
I'm palpating his abdomen. Okay, I'm gonna listen to his lung sounds. Okay? They sound present and equal. I'm gonna go ahead and move on to assessing his legs. Sir, have you had any history of motor vehicle accidents or of anything of the chest pain variety?
No.
Can you wiggle your toes for me? Can you tell me which toe I'm pressing on?
The pinky.
I feel a pulse, and he was able to wiggle his toes. Good pulse motor sensation. I'm gonna go ahead and feel this leg. There's scrapes on this portion of the body. I find a pulse. It's good. Can you tell me which toe I'm pressing on?
Big toe.
All right. Can you wiggle your toes for me? Perfect, perfect. I'm gonna go ahead and, since there's scrapes, I'm gonna go ahead and assess, and I'm gonna feel the genital area. It does not tell me anything, and I don't feel anything unusual. I noticed scrapes on this part of his arm. Can you wiggle your fingers for me? Can you tell me which one I'm squeezing?
My thumb.
And I'm gonna find his pulse. It's present. When did you last eat?
About 3 p.m.
There are no scrapes on this arm, neither on his leg. I'm gonna find his pulse. It's present. Which finger am I squeezing?
Middle finger.
Perfect, perfect. On a scale of 1 to 10, 1 being the least pain, no pain, 10 being the worst pain you've ever felt in your life, where do you put this at?
5.5.
Perfect. What type of pain is it? Is it just like an ache?
Like an overall pain.
Is it like an ache though? Is it stabbing? Is it burning? Is it?
More of an ache.
Okay, great. How long have you had this pain?
Since as soon as I fell off the bike.
Okay. I'm gonna do his eyes, check for his pupils. Great, they're pearl. Now I'm going to roll him over to assess his other side. And since he's so tall, I'm going to ask my partner to assist me. On 3, we roll. 1, 2, 3. Then I would assess his overall back and lumbar region. I would feel his buttocks, and then I assess this side. I assess again the burns and the scrapes. I log roll him back. And I reassess. And then I would treat his scrapes. I would lightly scrape any debris out of it that I can. I would soak a bandage, a trauma bandage, in saline, apply it, and bandage. Does anything make it better? Anything make the pain worse?
Not yet.
Okay. And then I would package him for transport. I would roll him, put him on the longboard. Then I would roll him onto the longboard. We would put him on the board onto the stretcher. We would package him for transport. And I would reassess him every 5 minutes as he is gradually going from stable to unstable. And he could crash at any second. And I would indicate the high priority at the hospital.